Okay. Um, two last quick questions. One, how do you feel about the future of this in the pharmaceutical industry? Because I know you're speaking earlier about funding and money, and it sounds like if pharma did get on board, there would be a lot of funding for studies and things like that. But then I think interesting things happen when when compounds go the drug route. How do you feel about the role of the pharma in the future of stem cell supplements and drugs?
I am here going to answer only speculative because I don't know if really that's what happened. But there are compounds. When I first, okay, let me go far here. When I first came out with this idea, this concept, and everything, I wanted to have the backings of a third party from the scientific community to make sure that whatever I was saying here was solid, and mostly for the FDA as well. So I connected with a professor of fertility embryology at University of Illinois, and I sent him all the data that we had on this blue-green algae at the time, the fact that releasing your own stem cells was going to help tissue repair and was going to support optimal health, all of that. So I sent all that information, and he gave us an expert testimonial basically saying that this claim is accurate. This claim is supported by the scientific literature, and it basically gave us green light to be able to use that claim. And that whole testimonial was very useful for us in the later years or later after, because when we did have investigations or questions from the FDA or the FTC, we were able to show that the science was there, and we had third party support for the message that we were putting out there. But this fellow, this scientist, called me about like what 3 6 months later, and he said, Krish, I just wanted to share something with you because I want you to get the pulse of what you're doing. He said, I'm a consultant for a number of other pharmaceutical companies that are investigating, what they could do in the stem cell space. And he said, I just want you to know that when I received your documents at first, my first reaction was like, this is nonsense. This is nuts. But as I'm reading all of this and I'm looking at all this information, I'm realizing you're really onto something here. This is real. And of course, his testimonial, his expert testimony was reflecting that. But he said, I just wanted you to know that you're at least 5 years ahead of the pharmaceutical because they are not looking at it from that angle at all. And so it was for me a very rewarding, if you want, message. But I knew that the pharmaceutical had drugs. The one that I referred to before, that is a blocker of CXCR4, they had drugs that could do exactly the same thing. So at the time, I thought it's going to be about like 5 to 8 years, maybe, and then all of that is going to come on the marketplace, and it would be out there in the health space. We are 15 years later, and it's
Hmm,
still not there. And
interesting.
I believe, this is just me, that's the part that I'm saying is speculative.
Hmm.
I believe that the reason why it's not there, it's because it is bringing, it's not a paradigm shift. It's a tidal wave shift. It's like a complete uh, typhoon change in the whole world of health. Today, the entire pharmaceutical world is not curing anything, it's palliative.
Yeah.
You get diabetes, I sell you insulin every day of your life for the rest of your life. It's an amazing business model. You take just about any drugs out there, they're all designed not to cure your problem, but to maintain you for the rest of your life. And now a concept comes. That concept is curative.
Hmm.
I assist your body to repair. Once that is done, it's done. So it's for a short amount of time. It is a huge shift in the way that the pharmaceutical world is working. Not only a huge shift, but it's also, if I put it from that angle, it's probably a huge threat to their survival with this palliative model that they have. So I think that they're extremely reluctant to go in that direction when they have no choice to go in that direction, because the whole field of stem cell, the space, is growing so much and it is showing that is curative as an approach. I think that then we will see them coming forward with those kinds of compounds because they already exist. So I think that down the road, it's almost unavoidable that it will get there, but it's going to get there uh, because the market is forcing it, and they will probably get there kicking and screaming.
Yeah, wow. So basically, it's going to take a different zeitgeist from the popular culture for that to happen. Like it's going to have to meet the demand of the people.
I think that when the utilization of stem cells grows uh, worldwide, and with some of the countries that are trying to prevent it, the US being in one, but Europe, France, Germany, all of those, as the stem cell space grows and is demonstrating more and more that that modality is different. It's bringing something else that is normally an exception in the medical space, which is curative instead of palliative. When that grows,
Yeah.
because if you think about it right now, cure, we use the term, in our language, but it's virtually absent from the medical space. We
Yeah.
don't cure a lot of things. We just give you a better quality of life with that thing. So when cure starts to really become a thing, then I think that that is when that title shift is going to slowly take place in our society. And the beauty is that, yeah, the pharmaceutical model will have a response to that because they have those molecules that can do that in the body by tapping into stem cells. They either have not realized that they have it because it's not how they think, or they're waiting for the right time to basically say, okay, now we have no choice. That's the only direction for us to go, and then they will come out for these. I think I'm just speculating here because if they knew what they had in their arsenal, um, they're really good at not releasing it.